I'm Emma Maaranen. I am faculty up at Central Oregon Community College in the massage therapy department, and I'm really excited to share with you more about what massage therapy can do in conjunction with what you do as practitioners to manage chronic pain. So first off, I just want to explain a little bit about massage therapy. Most people are familiar with massage, and it's either in one or two varieties. Either they're like, oh, it's lovely, you go to a spa, you're pampered, it's decadent, perfect thing to do on a nice Saturday. And then there's the other camp of people who believe that, oh, you're gonna go see a massage therapist and they're gonna stick their elbow in you and they're gonna make you hurt and cry and it's good for you. Those two forms exist, but that is not solely what we do. So in massage, we have several different expertise that most of our massage therapists gravitate into. The first one is what I usually call the relaxation massage techniques. And these are generally modalities that are long, flowing, light touch strokes. They don't necessarily have to be done with an unclothed client. They don't even necessarily have to be done on a massage table or even at a massage practice. Oftentimes, our therapists will go into hospice centers. We send some of our therapists to do internships in the oncology department. Do chair massage at a lot of events, a lot of different avenues that we can get our hands on clients without having to have a client necessarily come to us who may not be able to because of some limitations that they have. Some of the key words for that, you'll hear people say that they do Swedish massage, chair massage. Many of those words describe more of a relaxation massage. Some of the things that's most important for helping with is increasing circulation to local tissues, and it's a great stress reducer for people, and with muscular pain it can just oftentimes ease some of that consistent nagging of it. Myofascial release is getting a lot more press in the media. At the college, and actually at most massage schools, we do not teach much myofascial release. And the people who do those practicing modalities then have done additional education. Myofascial release, we are just working with the fascial lines that connect muscle tissue. And I always call it like we're looking for the snags in the sweater and trying to kind of stretch them back into the right organization. These modalities really beneficial for especially people with limited mobility. We're able to help just get some tissue flexibility back in there and of course some circulation increase. Then we have the structural modalities, and these are the ones that have the reputation for us beating you up. But they don't necessarily have to be that way. I would say that is an overly aggressive treatment. But these are some of the modalities such as neuromuscular therapy, structural integration, Rolfing. And in most of these modalities, they are not a full body treatment. They are very targeted to a specific area of your client's body, and the therapist is working generally with the consult of the client's medical team to either rebalance some asymmetries in the body, especially when we're dealing with spinal conditions, or maybe helping to manage some contributing postural deviations. Then we have the Eastern massage practices. This has largely been covered in some light. We were talking about acupuncture, but it is based on Chinese medicine, and it is generally more of a compressive type of massage with a fair amount of stretching, kind of blending in even some yoga into those treatments. And then finally, we have the class of energetic body work, and in here, it's our craniosacral therapy is the one that generally I find physicians, it makes the most sense to refer for that. So then what I thought I would do is I would share with you just a few examples of common chronic pain clients and how massage therapy may be valuable in contributing to this individual's care. With someone who, say, has low back pain, very common, your client may benefit from going to relaxation massage modality. A lot of the benefits of that, again, are just increased circulation and just simply creating touch on people really returns the human component to a lot of their elements. A lot of people who have chronic pain are so used to being stiff and kind of a little pariah that just compassionate touch has amazing benefits. Also, those techniques, Eastern, have a lot of benefit in reducing pain and increasing range of motion. Simply put, if the muscle has better circulation to it, is more available to lengthening and contracting, it generates a lot less pain and will increase some of that client's mobility. And in that, we see a lot of evidence showing that regular massage is increasing clients' ADLs. Another example are a lot of the neurological pain disorders. So degenerative disc disorder, incredibly common. Really similar benefits with all pain from a relaxation massage technique. One of the things that's really valuable for a lot of these people are connecting them with someone who does more of a structural based body work. And again, a lot of that is going to have to do with rebalancing the spine, reducing some of the asymmetrical loads going into the compromised disc spaces, and dealing with other postural changes. We work with a lot of chronic pain conditions. For fibromyalgia, which is really fascinating, there's not a lot of research about massage that is from non-biased funding sources, but there is becoming more and more, and fibromyalgia is one of those avenues that does have a lot of research behind it. And myofascial release techniques have been amazing at reducing a lot of the sensitivity, a lot of the pain spots associated with the chronic pain clients. The one caveat with that is when you do look at research introducing any of the more firm touch techniques, like a lot of the structural techniques, most of our chronic pain clients have negative response to that, and I think it's just too aggressive for them. So if you have a client who's dealing with one of those conditions and they've had a negative massage experience, I would ask this further question and find out what type of modality they've experienced, because it may have just been that they were sent to a Rolfer when they really needed to go to an Eastern practitioner. Tension headaches, we work with a lot of tension headaches, and we are a great ally for the medical community in doing that. A lot of tension headaches, as we know, have root causes from referred pain from trigger points and some postural deviations. So again, with those clients, particularly referring them to a neuromuscular therapy specialist is great. Those therapists have advanced knowledge of all the referred pain patterns. That distracted me. And yeah. Structural techniques, again, if somebody has some postural distortion, we're very adept at balancing the muscles to address some of the conditions like head forward posture and hyperkyphosis. And then our craniosacral massage therapists, there is no empirical evidence, but anecdotally we have so many clients who say that craniosacral therapy is significantly helping them manage their tension headaches. Some interesting little facts. There's also a fair amount of research in massage with a lot of psychological conditions. And in all of these studies, the things that they always have in common is that regular massage therapy reduces cortisol levels and increases serotonin and dopamine, not just immediately after therapy, but with continued therapy, those changes continue to go the right direction. And then finally, referring to a massage therapist, there's a lot of us out there. Connect with one of the massage schools here in town. There's COCC and Sage Massage School, and all of the practitioners who work at the schools are really well rooted in the local community and are happy to give you recommendations, not necessarily to our graduates, but to all of the people that are in our community, because we're pretty well connected. Thanks.